Welcome to another deep dive into the world of canine neurology.
Always exciting to be here.
Today we're going to be unpacking some really fascinating research.
Okay.
It delves into the mysteries of cerebrospinal fluid, CSF,
Right.
and what it can tell us about the health of dogs.
Yeah, it's an area that's really ripe for discovery, I think.
Yeah.
Especially when it comes to understanding and diagnosing neurological conditions.
Absolutely. The research we're looking at today
Okay.
focuses on creatine kinase, CK,
Right.
and its potential as a biomarker for neurological issues in dogs. You've probably heard of CK
Yeah.
in the context of muscle damage,
Yeah.
but its role in CSF is a little less well known,
Right.
particularly in veterinary medicine.
Yeah, that's right. It's been studied in human medicine
Okay.
as a potential indicator for a range of neurological conditions.
Mm-hmm.
But yeah, big knowledge gap when it comes to dogs. So this study really wanted to bridge that gap by establishing some baseline values for CK
Okay.
in the serum and the CSF of healthy dogs.
So they essentially created kind of like a reference point, like a normal range,
Yep.
against which we can compare results from dogs that maybe are suspected of having neurological problems.
Exactly. So we have something to compare it to.
Yep.
They looked at total CK activity,
Okay.
but they also looked at the distribution of its three main isoenzymes.
Okay.
CKMM, CKMB, and CKBB.
Okay. So we've got these three different isoenzymes.
Yeah.
And each one is kind of like a specialized version of CK,
Yeah,
predominantly found in specific tissues.
exactly.
So we've got like our CKMM, which is primarily found in skeletal muscle, CKMB, that's associated with cardiac muscle,
Right.
and then CKBB.
Yes,
And that one's the one that we see the most in the brain.
that's right. Most prevalent in the brain.
Okay.
Now, what makes this study particularly interesting is the difference they found in the distribution of these isoenzymes between the serum and the CSF.
Okay, so what happened when they looked at those distributions?
So in the serum, CKBB and CKMM were found in roughly equal amounts,
Okay.
but in the CSF, CKMM was the predominant isoenzyme.
Interesting.
And that's a little bit of a surprise
Okay.
because in human studies, CKBB is typically the dominant one in the CSF.
Okay, so that's a significant distinction. So in healthy dogs,
Yeah.
CKMM takes the lead in CSF.
Yes.
Why is that difference in the isoenzyme distribution so important?
Well, it suggests that any detectable elevation of CKBB in canine CSF could be a red flag,
Okay.
potentially indicating a neurological issue, because CKMM is already the main player in normal canine CSF.
Right.
Even a slight increase in CKBB
Yeah.
could signal that something's going on
Okay.
because it's unlikely to be coming from normal muscle activity.
So finding elevated CKBB in a dog's CSF could point to a neurological issue, something like encephalitis, meningitis, even a brain tumor.
Exactly. Has the potential to be a really sensitive indicator.
Yeah. That's fascinating.
It is.
It seems like this research provides us with a whole new lens
Yeah.
through which we can view canine neurology,
Yeah.
offering valuable insights into what's happening within the brain.
That's a great way to put it.
So now I'm curious, how can this be applied in a clinical setting?
Yeah.
How can veterinarians use this knowledge to better diagnose and treat neurological conditions in dogs?
That's the crux of the matter. Now that we have these baseline values
Yeah.
for CK and its isoenzymes in healthy dogs, we can start to investigate
Yeah.
how deviations from these norms might actually correlate with specific neurological conditions.
So it's not just about looking at total CK anymore.
Right.
We need to pay attention to those individual isoenzymes,
Exactly.
especially the CKBB.
Especially the CKDB. So
Okay.
it opens up this whole new avenue for research and has the potential to really significantly impact how we approach the diagnosis and management of neurological problems.
Yeah, I imagine there's still a lot to learn,
Oh, absolutely.
but this research definitely feels like a major step forward.
It is. It is. It lays the groundwork for future studies
Yeah.
to investigate the clinical usefulness of CK
Okay.
as a diagnostic and a prognostic tool.
Before we dive into some of the potential implications of this research, I'd like to take a closer look at the study itself.
Okay.
Can you tell us a bit more about the methodology and the specific findings?
Certainly. So the study involved 55 healthy dogs,
Okay.
a mix of breeds, both sexes, ranging in age from 1 to 8 years old.
Okay.
And all the dogs underwent a thorough neurological exam
Okay.
to make sure that they were truly healthy and didn't have any underlying conditions.
So they established this control group to represent what normal looks like
Exactly.
in terms of CSF, CK levels.
Yes.
Yeah. Okay. So the researchers collected both blood and CSF samples from each of these dogs.
Yes.
And the CSF was obtained via lumbar puncture.
Yep.
Which is a procedure that allows for the collection of fluid
Yes.
from the space surrounding the spinal cord.
Correct.
Now, I know lumbar punctures are common in human medicine.
Yes.
But what about in veterinary practice?
Well, it's not a routine procedure,
Okay.
but it is a valuable diagnostic tool
Okay.
for assessing conditions that are affecting the central nervous system
Okay.
in dogs.
And once they had those samples,
Yes.
how did they analyze them?
So they used a technique called electrophoresis
Okay.
to separate the different CK isoenzymes
Okay.
based on their size and electrical charge.
Okay.
And this let them quantify the amounts of CKMM, CKMB, and CKBB present
Okay.
in both the serum and the CSF.
So they went beyond just measuring total CK activity.
Yes.
And actually looked at the specific breakdown
Yes.
of those isoenzymes.
Exactly.
And as we discussed earlier, they found some intriguing differences
Yes.
between the serum and the CSF.
Yes.
Particularly regarding the predominance of CKMM
Right.
in the CSF of healthy dogs,
Exactly.
which raises some important questions about the role of CK
It does.
and its isoenzymes
Yeah.
in canine neurology.
It certainly does. Now that we have this baseline data,
Yeah.
we can begin to explore how alterations in these levels
Yeah.
might actually relate to specific neurological conditions.
This is where things start to get really exciting.
It is. Think about the potential for earlier and more accurate diagnoses,
Yeah.
leading to more targeted and effective treatment.
It could revolutionize how we approach canine neurology.
It could indeed.
So we've covered the basics of CK and its isoenzymes.
Yes.
We've delved into the methodology of the study, and we've touched upon those key findings.
Yes.
Now let's explore the implications of these findings
Let's do it.
for diagnosis,
Yeah.
treatment, and potentially even prognosis of neurological conditions in dogs.
I think you'll find it quite fascinating. If we think about the clinical implications of this research, the potential is pretty vast.
Yeah.
Imagine, a veterinarian is examining a dog that comes in and they're presented with seizures or weakness or maybe altered behavior.
Symptoms that could really indicate so many different underlying conditions.
Precisely.
Yeah.
And right now, diagnosing these neurological issues in dogs, it can be really challenging.
Yeah.
It often involves a combination of looking at clinical signs, advanced imaging,
Oh.
like MRI or CT scans, and then sometimes even more invasive procedures like doing a CSF tap.
Right. So this research is really suggesting that analyzing those CSF CK levels, and particularly looking at that CKDB isoenzyme, could offer some really valuable insights.
It could.
And maybe even streamline that whole diagnostic process.
Yeah, that's the hope. So if we find elevated CKBB in a dog's CSF,
Yeah.
it could strengthen the suspicion that there's a neurological disorder there.
Right.
And allow vets to pursue further diagnostics and potentially even treatments more confidently.
So it could act as sort of like an early warning system,
Yeah.
prompting more targeted investigations earlier on.
Yeah, exactly. And early detection is key.
Yeah.
When it comes to neurological conditions,
For sure.
the sooner you can identify the problem and initiate treatment, the better the chances of a positive outcome.
Right. This could be a game changer for dogs that are dealing with these conditions, like encephalitis or meningitis,
Yeah,
even brain tumors.
absolutely. It certainly has that potential. But it's important to remember this research is really just that first step.
Sure.
More studies are definitely needed to validate these findings
Okay.
and establish some clear clinical guidelines for using CSF CK as a diagnostic marker.
What are some of the key areas that future research should focus on?
Well, for starters, we need to look into how different neurological conditions specifically affect those CK isoenzyme levels in the CSF. So do certain conditions consistently lead to a more pronounced elevation in CKBB?
Right.
Or are there specific patterns that we see
Yeah.
associated with different types of neurological disorders?
So we need to correlate those CK levels with specific diagnoses.
Exactly. And then beyond diagnosis, another really crucial area is prognosis.
Okay.
So can CSF CK levels actually predict how a dog might respond to treatment?
Right.
Or give us some insight into the long-term effects of a neurological condition?
That's the burning question. Could this be a tool to help us make better decisions about treatment options and maybe manage expectations for recovery a little bit better?
That's certainly a possibility. We need some long-term or longitudinal studies
Okay.
to follow dogs over time and track those CK levels
Okay.
and see how they correlate with the dog's clinical progress.
Yeah.
And then that'll help us really understand if CK levels can serve as a prognostic indicator,
Right.
which would be huge because then it could guide us in making more informed decisions
Yeah.
about patient care.
It's like putting together a puzzle,
Yeah.
piece by piece, until we have a clearer picture
Right.
of how CK can inform our understanding of canine neurology.
That's a great way to put it. And, this research also highlighted something really important, the importance of species-specific research.
Okay.
The fact that CK behaves differently in dogs than it does in humans
Yeah.
underscores the need for really dedicated investigations into canine neurology.
We can't just extrapolate findings from human medicine and expect them to apply directly to dogs.
Exactly. Dogs have unique physiological and metabolic processes,
Right.
and understanding those nuances is key
Yeah.
to advancing veterinary medicine.
This study is really a good reminder that dogs aren't just small humans with fur.
That's right.
They have their own unique biological characteristics
Yes.
that demand very focused research.
I completely agree. And this research really paves the way for a much deeper understanding
Yeah.
of canine neurology,
Mm-hmm.
which could lead to improved diagnostics and treatments,
Mhm.
and ultimately better outcomes for our furry companions.
That's a great thought. So we've explored the potential of CK as both a diagnostic and prognostic tool.
Right.
We delved into areas for future research.
Yes.
We emphasized that importance of species-specific studies.
Yes.
But before we get too carried away with all the possibilities,
Right.
we do need to acknowledge that CSF analysis,
Mm-hmm.
including this CK measurement,
Yeah.
it's not without its limitations.
That's an important point.
Mm.
CSF analysis can be incredibly informative.
Yeah.
It's not a routine procedure in veterinary medicine.
Right.
It requires specialized equipment, expertise,
Right.
and it does carry some inherent risks.
Can you elaborate on those risks a little bit?
Of course, obtaining CSF typically involves doing a lumbar puncture,
Yeah.
which, while it's generally considered safe,
Mm-hmm.
it can lead to complications like bleeding or infection,
Right.
or even neurological damage if it's not performed correctly.
So this is a procedure that requires very careful consideration
Absolutely.
and should only be performed by experienced veterinarians.
Absolutely. And it's also worth noting that CSF analysis is just one piece of the puzzle.
Right.
It should always be interpreted in conjunction with the dog's clinical signs,
Okay.
their history, and other diagnostic findings.
It's not a standalone test.
Right.
It's part of a broader approach
Exactly.
to understanding and managing neurological health
Yeah,
in dogs.
precisely. And I think it's really important for dog owners to have realistic expectations.
Yeah.
While this research is very promising,
Right.
it doesn't mean that CSF CK analysis is going to become routine,
Right.
part of every vet exam,
Yeah.
but it does suggest that it could be really valuable
Yeah.
in specific cases.
Absolutely. And as research in this area continues,
Yeah.
we'll get a clearer understanding of when and how to best utilize this tool to help our canine patients.
That's right.
So we've covered the excitement, the potential, and the need for more research. But what about the practical side of things?
Yeah.
What does all of this mean for dog owners?
That's a great question. I think for dog owners, the key takeaway from this research is that it's really important to be vigilant about any changes
Yeah.
in their dog's behavior or neurological function.
Being aware of those subtle signs that something may be off.
Exactly. If you notice anything unusual,
Yeah.
seizures, stumbling, weakness, changes in coordination, head tilt, maybe even just a shift in their normal demeanor.
Yeah.
It's crucial to contact your veterinarian right away.
Early detection is so important.
Absolutely. And while, again, CSF analysis isn't routine
Right?
for every veterinary visit,
Yeah.
this research does suggest that it could be a valuable tool in certain cases.
So if your dog is showing signs of those neurological problems, don't hesitate to talk about the possibility of CSF analysis with your vet.
That's right. Open communication with your veterinarian is key.
Yeah.
Share your concerns, ask questions, and just be an advocate
Yeah.
for your furry friend.
This research really empowers both veterinarians and pet owners, with the knowledge
Yeah,
to make those more informed decisions
it does.
about their dog's neurological health.
Absolutely. Knowledge is power, especially when it comes to our pet's well-being.
This has been a really insightful deep dive
Yeah.
into the world of canine neurology
It is a fascinating field.
and the potential of CK
Yeah.
as this tool for understanding neurological health in dogs.
Immense potential for improving the lives of our canine companions.
Any final thoughts for our listeners before we wrap things up?
I would just encourage everyone to embrace the power of curiosity,
Yeah.
stay informed, ask questions, and be an advocate for your pet's health.
Yeah.
There's always more to learn, and that knowledge can make all the difference.
Yeah. It really does feel like it's paving the way
Yeah.
for a much more nuanced understanding of canine neurology.
Absolutely. And I think one of the most exciting aspects is how this might actually change the way we approach treatment. Absolutely.
You mentioned earlier that early intervention is key.
Yeah.
How might this knowledge about these CK levels impact our ability to intervene earlier and more effectively?
So let's say you have a dog that comes in and it has some vague neurological signs.
Okay.
Like maybe some intermittent weakness or some subtle behavioral changes.
Right. Those can be really tricky cases to pin down sometimes.
They can be, and in the past we might have taken kind of a wait-and-see approach.
Yeah.
You know, we monitor the dog and we wait for some more definitive signs before we pursue more invasive diagnostics like a CSF cap.
Right. But with this knowledge about CKBB
Yeah,
as a potential early indicator,
exactly.
we might be more likely to actually do that CSF analysis sooner,
Yeah,
especially if the dog's presentation is concerning
exactly.
for a neurological condition.
That's the idea.
So it could shift our decision-making process,
Yeah.
leading to earlier and potentially even more aggressive intervention.
And if we can catch these conditions early on before there's irreversible damage, the chances of a successful outcome increase dramatically.
Absolutely. And it's not only about
Yeah.
earlier treatment, but it could also help us tailor those treatments more effectively.
Exactly. How
So,
So different neurological conditions respond differently
Yep.
to various therapies.
yeah.
So let's say we identify elevated CKBB in a dog that we think might have encephalitis.
Okay. Inflammation of the brain.
Exactly. We might be more inclined to start anti-inflammatory medications
Oh.
or immunosuppressive medications sooner
Yeah.
and at a higher dose.
So it could guide our choices
Yeah,
and help us select the most appropriate treatment strategy
exactly.
to each individual patient.
Precisely. And as we continue to gather more data about how these CK levels correlate with different conditions and their treatment responses,
Yeah.
we can refine our approach even further.
It's really all about providing the best possible care
Exactly.
for these animals.
That's always the ultimate goal.
Yeah, this research opens up a whole new realm of possibilities
It does.
for personalized medicine
It does.
in canine neurology.
It's an exciting time to be in veterinary medicine,
It is.
especially in neurology.
Absolutely. There's so much we're still learning.
There is.
And this research is really a testament
Yeah,
to the incredible progress
it is.
that's being made.
It's a reminder that even in these really complex fields like neurology,
Yeah.
there's always room for new discoveries and breakthroughs that can really make a difference.
Absolutely. Well, this has been a really insightful conversation.
Yeah, thank you.
Thank you so much for sharing your expertise with us.
It's been my pleasure. I'm always happy to talk about canine neurology.
And to our listeners, thank you for joining us on this journey into the world of CSF and the potential of CK as a tool for understanding neurological health in dogs. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.